Thanks so much, Mike, for that update. The Mississippi Healthcare Alliance has a new campaign this year. It's called Dial, Don't Drive. And for more behind that message, we're joined this afternoon by Dee Howard, the Executive Director of the Mississippi Healthcare Alliance. Dee, thank you for joining us on Midday. It's good to have you here.
Thank you, Jules. Pleasure to be here.
Okay, so tell folks what Dial, Don't Drive means.
Well, the Mississippi Healthcare Alliance is here to educate our community and public about the importance of dialing 911. When you have symptoms of heart attack or stroke, you really should call an ambulance because you can get to the hospital so much quicker and safer than if you were to get behind the wheel yourself or have a loved one take you to the hospital.
Is that something that a lot of people tend to do? They try to drive themselves or wait on a family member?
It really is. In fact, Mississippi has probably one of the highest incidences of people wanting to take themselves to the hospital instead of calling 911.
Okay. And I would imagine a lot of that people, you know, an ambulance, it costs money, and for people that might not have insurance, that might be an issue for them. They might be thinking about that.
Yeah, people worry about, well, it might cost, or what if I just bother the neighbors and it's not a real emergency, or the fear of, you know, waking people up with a siren or something like that.
Better to be safe than sorry.
Oh, yes, indeed. Better to be safe than sorry. Call 911. Let them take you to the hospital.
Okay. And so you were mentioning, you know, if people are feeling the symptoms of a stroke or heart attack, can you remind people what some of those symptoms are?
Right. Well, heart attacks generally involve chest pain, but they don't always involve chest pain, especially with women. But shortness of breath, feeling tired, nauseated, abdominal pain. Sometimes people think it's indigestion or pain that goes up into the jaw or down the arm. Those are common typical symptoms. Women have more atypical symptoms than men. Could just be feeling tired. And then stroke, we worry about sudden onset of loss of feeling or movement in one side of the body, or sudden loss of vision in one eye, sudden inability to speak or form words that you normally could converse in a normal conversation. All those are things to pay attention to, because these are time-sensitive diseases that if we get to the hospital early, we can actually help that patient have better outcome.
Okay, and so that's why we're telling people to dial and don't drive.
That's right.
Okay, and then one other thing I wanted to ask you about, you all, how have you all been working to increase time to care and increase survival rates? What exactly is time to care?
Time to treatment issues means, number one, educating the public on the symptoms and to pay attention to those symptoms. Call 911, get to the hospital early. Paramedics are trained to recognize those symptoms as well, and they know which hospitals are best suited to treat the patient, such as for the heart attack patient to go to the cath lab hospital or the cath lab ready hospital, the stroke patient to go to the stroke ready hospital. When you do all those things, you're decreasing time to treatment, and that really saves lives and, you know, has better outcomes. It's been shown in data that we've looked at.
Well, Dee, thank you very much. Lots of very good information, telling people, reminding them, dial, don't drive, in the event that you have symptoms of a heart attack or stroke. And if you want more information, you can give the Mississippi Healthcare Alliance a call. Their number is right there on your screen, 601-291-9872, or you can go online to www.mshealthcarealliance.org. All right, coming up, meteorologist Michael Haynes will have a look at our full forecast right after this break.